What is chronic cough?
Chronic cough is a fairly simple thing, but it causes an enormous amount of problems in patients. They have repeated episodes where cough comes along, troubling them. It usually occurs in spasms, which the doctor calls paroxysms, and during those times people are incontinent, they can go unconscious. There's an enormous decrease in the quality of life of the patient with chronic cough because it goes on day after day after day.
What is your experience and background with chronic cough?
I've been working on chronic cough now for 30 years. A patient was the first one who came to see me with this chronic cough, and I couldn't work out why. And the patient herself said, could it be the drug? And we were trying a new drug for her blood pressure. And this drug, we stopped, the cough went away, started the drug again, the cough came back. So eventually I understood that it was the drug causing the cough. And I've been hooked ever since about trying to find the cause of the cough. Still, I see people on this drug and others similar, which cause a cough, but in fact the vast majority of other people have other causes for the cough, not the drug.
Is chronic cough difficult to diagnose?
It's difficult for many other specialists and general practitioners. That's because they've not been taught about what the causes of chronic cough are. It's only in the last 10 or 15 years that we've really understood what the causes of this chronic cough are. So when they were in medical school, they were never taught about the causes of the chronic cough.
So do GPs and specialists have a good knowledge of how to diagnose chronic cough?
No, the diagnosis of chronic cough out in the general medical world is very poor. Many people will say it's asthma, and only a small fraction of people with chronic cough actually have asthma. The cough is often not actually originated in the lungs. It's mainly a form of reflux which people get, but it's not the same as the reflux that the doctors were taught about in their medical school. It's not heartburn.
Okay. And is there a definition of chronic cough?
Chronic cough is defined arbitrarily, really, by colleagues as a cough that lasts greater than 8 weeks or 12 weeks. And so you have to have a long-term cough. Some people have a virus and then the cough goes on for a few weeks. But these people with chronic cough, often they have cough lasting months, years. My record is 66 years chronic cough, and we made her better as well.
And are there a lot of people out there who suffer with this condition?
Yeah, a survey of people from general practitioners' lists, randomly selected from general practitioners' lists in Yorkshire, reckons that it's about 1 in 10 of the population have the chronic cough. We've just done a worldwide survey of 500,000 people. And that 500,000 people, their incidence was exactly the same as it was in Yorkshire, in that it was 1 in 10 of the population, whether you were in China, Korea, Australia, America, or Europe.
So it's a lot of people.
An awful lot of people suffer with this chronic cough, and when they go to ask for medical advice, because the doctor doesn't know about it, they're told that it's only a cough. But we know that people with chronic cough have a quality of life which is worse than people with cancer. So it's not something which should be dismissed.
And what is the cough clinic?
Cough clinic, I set up the first cough clinic in the UK about 25 years ago. And we see people do the appropriate investigations. Many doctors will do inappropriate investigations which don't help with the diagnosis, making it even more mysterious. But we do the appropriate investigations to try and find which group of cough you are in. And then we usually give simple treatments and recommend to the doctor simple treatments. So your own doctor is able to go through the list of common medications with you and give you the correct treatment.
And is there now a set of guidelines that are used by the clinic?
We've developed over the years the British Thoracic Society guidelines, which you can get online, or the European Respiratory Society guidelines. So it's all very evidence-based.
So what success do you have with patients at the clinic when they come to you?
We reckon that about 9 out of 10 patients are improved with the simple cough remedies that we use. It's not the cough remedies that you can get over the counter. They're cough remedies that the doctor can prescribe. They're normally used for other things. And the key here is that the doctor doesn't think about using these simple treatments, widely available treatments, through your doctor, which can dramatically help people.
And so if 9 out of 10 can be easily cured with simple treatments, is there hope for the 1 in 10 as well?
1 in 10 are the people we get back to the clinic, and then we have a series of other strategies that we use, up to and including an operation can help. So even if you don't respond to the simple treatments, that's where we would really like to see people. The trouble is we get too many people coming to the clinic because the doctors out there don't understand what the simple treatments can do.
Is there a way that patients can get an easy diagnosis prior to visiting the clinic?
Because the doctor is stumped, there is no explanation in their mind because they haven't been taught about it. What we can do is patients can go onto a website and actually get a questionnaire off this website. This questionnaire will be sent back to the computer where it's marked according to an algorithm that I've constructed. So it's like coming to see me, answering this questionnaire, and I have constructed this so that the computer will mark it automatically and send it back to you. And that will give you the diagnosis based on this questionnaire. It's validated. We've published it in a very good quality journal showing that nearly 10,000 patients have been successfully managed this way. And this questionnaire gives you the diagnosis, and what we've got in the website is all of the advice that I would normally give for the simple treatments and a recommendation to the doctor so that these simple treatments can be followed by the doctor and find the right treatment for that individual patient.
Professor Morice, thank you very much.
Thank you very much.